Let's continue our discussion on palpation, the anterior fontanelle or the neck. Pal- Palpating the anterior fontanelle. This is used to examine sick infants. The normal infant's anterior fontanelle is moderately tense and pulsates. Its surface is level with the surrounding bone of the skull. In general, the anterior fontanelle begins to shrink in size when the infant is about 6 months of age and closes completely by about a year and a half of age. The anterior fontanelle often shows abnormal bulging, depression, or delayed closure. In general, a bulging anterior fontanelle signifies heat strength. It is seen in epilepsy and in dangerous stages of heat diseases. A depressed anterior fontanelle signifies an illness of deficiency. This may be due to prenatal insufficiency or malnutrition, which leads to insufficiency of brain tissues. Severe vomiting and diarrhea can also lead to a depressed anterior fontanelle, so can massive blood loss. Delayed closure beyond a year and a half of age occurs mostly in illness of genuine Qi deficiency, but also in rickets. Palpating the neck. The main purpose of examining the neck is to search for masses. The most important of these are the scrofula and goiter. Scrofula, known in Western medicine as tuberculous lymphadenitis, has the appearance of a series of swelling in the neck like a string of pearls. The swellings form rapidly and may be of variable size, the larger ones about that of a pigeon egg. If the swelling are hard and tender to pressure, they are mostly due to exogenous wind heat or phlegm heat collecting in the neck. Scrofula can also result when liver qi is unable to move freely and the spleen loses its dispersion and transportation functions. This leads to retention of water and dampness, which may transform into phlegm over time. The phlegm then collects in the neck. In this case, the lesions of scrofula form gradually and are hard. There is no tenderness or pressure, and the overlying skin remains normal. Early in their formation, the swellings are movable, but with time, some become matted to the surrounding tissues. Goiter. Goiter consists of swelling in the front of the neck on both sides, just below the main part of the larynx. It is not tender on pressure, and the overlying skin remains normal. Goiter tends to enlarge progressively and is persistent and difficult to cure. When examining the neck for goiter, the optimal position for the patient is to sit upright with both hands placed gently on the knees so that the neck is fully exposed. The physician sits or stands either in front, facing the patient, or behind and uses both hands. Note especially the location, size, and shape of the goiter. Goiter characteristically moves up and down with swallowing. If the goiter enlarges diffusely with indistinct borders, is soft to pressure and expands or shrinks with joy or rage, and has normal overlying skin, it is a Qi goiter. This is mostly due to dietary deficiency of iodine, repressed passions, Qi stagnation, or blood stasis. If the goiter or partial and semicircular in shape has a smooth surface and is not tender on pressure, it is a flesh goiter. It is due to mostly to melancholic brooding or repressed rage, accumulation of gel dampness, phlegm, Qi stagnation, or blood stasis. If the goiter is hard as stone, has an irregular surface, is unmovable, and is tender to pressure, it is a stone goiter. This is due mainly to Qi stagnation, accumulation of gel, phlegm, dampness, and static blood. It is mostly malignant. Thank you for your attention.